basically what happens is the societal construct itself is such that women have not been made to talk in a very open manner,
Right.
especially about their health issues. As I said, as a man, you need to be more supportive,
Right.
understanding and enabling. That is the most important part. I think everybody of us considers ourselves to be supportive and understanding husbands.
Correct.
But not all of us are enabling.
Right. Is it something that very basic thing that we are missing is just what are our women eating?
Yes.
Are they eating fine or not?
We don't want a child. We want to take some time off.
Yeah.
Why so much pressure put on her? The decision is mine.
Correct.
When we need to seek help, we will both seek help. As I said,
If ever you need to.
if ever we need to, and this is a private matter. It is something between a couple. Right? What she is asking you is only for support.
Yes.
Whatever you have assured her when you are taking those sat fere
Yeah.
or whatever it is, vows of marriage, that you are always going to be with her and things like that. She is telling you to only fulfill that. She is not asking you anything more than that.
Correct. Hello and namaskar. Welcome to another episode of The Thing with This One Is, a podcast where we talk to stalwarts and experts from different domains to understand their field of work. And today I am in Goa. I am here at the Mahatme Nursing Home in Bicholim in Goa, and I am talking to Dr Mithun Mahatme. Welcome to the podcast, Dr Mithun.
Thanks, Ram. Nice to see you.
And Dr Mithun is an expert in gynaecology. OBGYN as we know. So today we are going to understand gynecology. Now this is a topic that is not something that most men get into. So today's episode is about men and how they should deal with gynecological issues of various women in their lives. It could be sisters, daughters, mother, wife, anyone. Today what we'll try to understand from Dr. Mithun is what we as men can do better, Of course, we are always nice to the women in our lives. We take them to the doctor, we take care of them. But do we really do enough to understand what do they go through? So we'll talk about the physiology, we'll talk about primarily actually the mental aspect of things. Do we really understand our women? So let's get into this. Mithun, thank you so much for talking to me today. It is such a pleasure to be in Goa. And Goa is obviously such an awesome place to be. Great weather, lovely food. Thank you so much for giving the lovely food that we had just now. But today, I want to pick your brain on all these things, right? I know you very well. You've been a lovely friend, an elder brother because you're an elder brother of my very good friend Manish.
Yes.
But let's our viewers also know about who you are and, what have you done and where are you right now in terms of your practice and such things. Can you just give a little bit of a background that we can,
Yes, so I'm a practicing obstetrician and gynecologist and laparoscopic surgeon. I practice in North Goa. I started my practice in 2011 and since then I am managing our hospital which was founded by my father, Mahatme Nursing Home. So he was a pioneer who started this hospital first.
Yeah.
And now I am carrying forward the legacy. So definitely I have got a lot of pressure to live up to some expectations because certain amount of ethics and standards have been set by him.
Yeah.
So I have to live up to that.
Yes.
And I intend to continue to do that.
Lovely. Yeah, his father is Dr. Mukul Mahatme, a very well-known name in Goa. If you are in North Goa, you'll definitely must have heard of Dr. Mukul Mahatme. So let's start by first understanding the domain itself.
Okay.
Now you said obstetrics, right?
Yes.
And so most people just simply say OBGYN because
Correct.
most people don't know how to pronounce it also.
Yes.
What is the difference between the two, or is there any difference?
See, obstetrics basically deals with the birth. So anything related to pregnancy and birth. Gynecological aspect is basically related to non-birth issues. So whether it is vaginal discharge, tumors, bleeding issues, or various other things basically which the women can get affected with.
Right.
So if it is related to the birth aspect, then we call it obstetrics.
Right.
And the gynecological aspect, any other part other than the birth.
Okay.
So that is to simplify it, in sort of so that somebody can understand.
Sure. So I must tell everyone watching, while you're getting into this episode, be prepared to hear some really good truths. I'm not saying harsh truth, but good truths. Truths that you have stayed away from. A lot of times what happens is, Dr. Mithun, is that you don't want to deal with this. You know,
Exactly.
like some of the things that you already just said.
Yes.
Most men are like,
I know, yes.
right? There is a little bit of that.
Yeah.
The reason is societal, with the way we've been brought up, whatever it is, or just men being men, jo bhi hai.
Yes.
But there is something more that we can all do. So what I'm
Correct.
trying to tell here is that we are going to get into details, okay, like with all our episodes. And some of the things that we are going to say and Dr. Mithun is going to talk about may make you feel a little bit, but what I will suggest is get over it. Power through this. I'm certain that at the end of it, you will learn something and it will help improve your own lives, and not just yours, but a very important woman in your life, right?
Yes.
So, Dr. Mithun, don't worry. Just let's talk about everything.
Yes, surely.
I am okay. I am prepared to hear
Yes.
some of these, important things,
Yes.
which may make me feel a bit
Uncomfortable,
right.
but they will still do matter.
Correct. And I'll tell you my own personal experience. The reason why I wanted to talk to you about this, in my own life, I've gone through different stages. I was a teenager, 20s and whatever. The first time you start looking at women differently, for that matter, and then getting married. And then obviously mother is there, health of my mother and all that stuff. There is a whole different life stages bring you different things that you get exposed to. So first, I'll give you, for example, where I realized I don't know enough. When I was getting married, like we were in a courtship period, and I was not in India at that point, and my wife was in Pune. So we were talking on, video call and all that. And I just asked her once, like, hey, are you doing something over the weekend? And she said, no, I'm going to stay home. I said, why? What happened? She said, I have a tummy ache. So, I said, to pudin hara le lo. you know and she got so disappointed. Obviously what she wanted to say was
Yes.
that she had her periods at that
Periods,
time.
exactly.
Now point was, I didn't know that why she not, what is wrong with me suggesting ki pudin hara le lo.
Correct.
Obviously it is a little weird to say something like that. Later I understood that that is what it is, but then it made me find out more. So I googled and whatever, tried to understand. But important thing is, a lot of women don't like to talk about some of these issues. So let's start with that stage of life as men. When you are getting to understand or getting into serious relationships, then how do you sort of deal with it? So because women are not necessarily talking enough. So one, I want to understand that why do women not talk about their issues to their own husbands or boyfriends and things like that? And then what should men do therefore to understand it better
Correct.
at that stage of life? Let's say late teens to mid 20s, that kind of, when men are that age, and maturity is probably lower, but still.
So actually it all starts with the way a man thinks about this issue. So basically what happens is the societal construct itself is such that women have not been made to talk in a very open manner,
Right.
especially about their health issues.
Right.
And the least per se are the periods.
Right.
So the periods have always been historically a very hush-hush matter.
Right.
So I do remember, now you mentioned about your thing about the woman in your life, but I can also tell you a short story what happened to us with our own mother.
Right.
So many a times you can see your mother working in the kitchen and she's sweating and the fan is on.
Yeah.
Simple thing, the fan is on, she's sweating and she says, I'm feeling very hot, right? And you say, Mama, the fan is on, but still you're feeling hot. But you fail to realize that she could be somewhere around the 50s.
Yeah.
And she could be having those hormonal fluctuations,
Right.
giving rise to those hot flushes.
Right.
And we say, no, just sit in the AC and it is going to matter. So these things basically happens because of a mismatch in understanding from a man's point of view.
Yes.
Whereas what the woman would actually want to signify is that she is suffering.
Correct.
The same thing happens with the period, because since it's a very hush-hush matter, girls feel shy to talk about it. It starts right from the younger age when she is brought up by the mother. They see that the mother hushes it up. The grandmother has hushed it up. So how can suddenly a daughter or a young girl come out and say, I know, I want to talk about my periods?
Yes.
Because periods have been historically considered to be not a very such a clean thing.
Yeah.
You stay away from the religious things, you stay away from this, you stay away from that. A lot of restrictions come up.
Yeah.
The way science looks at it, I always tell my patients that be the first woman who gets your daughter out of this.
Right.
Because your grandmother or your mother-in-law has not helped you enough, you be the woman who helps your daughter.
Yeah.
Tomorrow when she has a daughter,
Yes.
she will be more helped.
Yes.
And she could be more, coming out with
Yeah.
whatever problem she faces.
Yeah.
So the basic thing is we need to give them a space to express themselves and not ignore it. Many a times they tell us of their problems, about their problems. And when we think of it purely as a man would think, what is the solution? Tummy ache. What is the solution for tummy ache? The pudinara. So you don't go beyond saying, is there anything would you like to say?
Right.
How come you are having this every month?
Right.
I am open to any discussion.
Right.
And if you feel it is affecting you, why don't we go and seek help?
Yes.
That would be the first step to enable a woman to open up without being shy, without being meant to look in such a way that she is not discussing something which I am not uncomfortable with.
Right. So you have to make sure that we create an environment or we react in a manner.
Yes, absolutely.
I think the first thing is to not joke about it.
Yes.
I have understood that.
Absolutely.
You know, and a lot of times men do joke about this and it is a bit crass.
You only realize that when maybe you don't get a good dinner back home.
Correct. And we have to be careful on some
Yes.
of these things. So you learn the hard way sometimes.
Yes.
But also at the same age, when you are that 20s, early 20s age, your mothers are going through a different problem.
Yes.
Which is perimenopause and menopause, that sort of a thing. Which is again completely not understood. You know, like if, and this is where I also want boys of that age, you know, men actually, to sort of get into the details of it. Because you don't know what is happening to your own mother. And then either you feel helpless, because you want to help. It's your mother after all, right? What should we understand better? Because somebody who's in their early 20s or late 20s, their mother is probably past 50, close to 60. And it is that age group where these things start happening. Fibroids, hysterectomy. What should we be understanding better about this?
So, I will not try to go into much of medical details.
Sure.
I'll try to make it as simple as possible. See, what happens is once the woman reaches perimenopause, her control and regulation and the best part of her body, that is her ovaries and the hormones, start failing.
Right.
So it is like a car without brakes, or rather a car with brakes which do not function well. So she cannot herself understand what is happening to her. See, let us say you have a toothache. You know you are having a toothache. You know that you need to go and seek help with a dentist.
Right.
But with a woman, what happens is she may have a simple symptom such as excessive sweating.
Right.
So she feels it is sweating.
Right.
So initially she may tell you put on the AC, increase the fan. But she may fail to understand these issues herself because her mother also tells her these are normal things. Her grandmother has also told her these are normal things. ये आपको सहन करना ही है. ऐसे होता ही है सबको, बाद में बंद हो जाएगा. So the idea is that when a woman has any symptom, if you talk to her, if those symptoms are bothering her, then you need to seek help. Or go to a person who could try to reason out whether those symptoms are worth investigating or they are something which needs to be ignored.
Yeah.
So the idea is, as I said, as a man, you need to be more supportive,
Right.
understanding and enabling. That is the most important part. I think everybody of us considers ourselves to be supportive and understanding husbands.
Correct.
But not all of us are enabling.
Right.
Because we would say, अरे मैं आज काम करके आया हूँ, next week जाएंगे. बराबर है ना?
Right.
So when we had a toothache, we want a painkiller instantly.
Right.
But when a lady has a problem, we say इस महीने देखेंगे, अगले महीने जाना है, कल ऑफिस में जल्दी जाना है,
Right.
तो नेक्स्ट वीक का अपॉइंटमेंट ले लेंगे. Without realizing that for the next 7 days she is suffering.
Oh, that's a lot of time.
Yes. So rather, if we try to understand the zest of the problem which she is facing, sit down with her, talk to her, and ask her, what do you want to do? How do you like to go about it? You know, should we seek help? Let me get the first appointment available. You understand?
Yeah.
That would be the best way to go about it.
And so how do you create that environment where that discussion itself is possible?
Yes, see, what happens is, you know, it ultimately comes down to our own family values.
Right.
How I have been brought up as a man.
Correct.
Right. So if I have been brought up in such an environment where the women are always looked down upon, they are not given the environment to grow, to express, then I would always say that, okay, somebody else's daughter, the moment she comes first, I would say very good, but I wouldn't teach my own daughter. I would say my daughter should not come out when my friends have come. तू अंदर बैठ के रहे, you just help in the kitchen. Now the moment you do this, you are differentiating. So the moment you differentiate, you don't give her an environment to talk. So the same thing goes to her husband's place when she becomes a wife. She will think she cannot express, so then she will express only to maybe her mother. Then her mother has to tell her husband, The same thing, if you make the, you get up your daughter in such a way, or you allow her to flourish in such a way that she can state what she wants, she can state what she's having or she's going through. Those are the family values that you need to grow in a very open atmosphere where you can talk about any issue and not be judgmental about it.
Correct. I think that's the key part, is not
Yes.
being judgmental. If
Exactly.
you are judgmental on any other topic,
Yes.
then the woman would feel even more that,
Yes, exactly.
skeptical about talking about this, because this is super judgmental. Then.
Exactly, absolutely,
So
absolutely.
whether it's what they are wearing or what kind of behavior they have, what kind of movies they are, अरे ये क्या देख रहे हो, क्या बकवास है?
ये आप नहीं देखते, आपको नहीं देखना चाहिए.
So when you do all of this, you're sort of unknowingly creating an environment where
Yes.
you're stifling communication.
Correct,
है ना?
absolutely correct.
And that just piles on, and then unfortunately what happens is it bursts out when it's really the limit.
Correct,
like
correct.
And then you अरे अब तो emergency में ही जाना पड़ेगा.
Correct, correct.
That is the worst situation. Now in both these situations, there's one more thing I wanted to talk about. Was there is a lot of sweeping under the carpet thing that kind of happens. अरे कुछ नहीं है, चला जाएगा.
Correct.
ये क्या है, गोली खा लो, whatever, which is kind of ignoring बोल दो, या कि अरे इसमें क्या है, सबको होता है, जैसे आपने थोड़ी देर पहले बोला भी. Now periods is one thing which is easily understood at such, but then there is irregularity of periods.
Correct.
There is PCOS, for example. All of these things are still, we don't know. We get to know when there is a diagnosis of it, probably. How should we deal with this stuff?
So, see, a lot of these diseases were not very common around 50 years back. So, a lot of these diseases are called lifestyle diseases now. It depends on the kind of what stuff we eat, our lack of exercise, then lack of early follow-up. Okay. So, a lot of patients come in a much later stage when they have obesity issues, they have irregularity of cycles, and everybody needs a quick fix. You want झट करके आंसर, सर दर्द हुआ तो immediately पेन जाना चाहिए.
Right.
You fail to realize that your body today is responding to hormonal changes. What is happening inside the body for last 2 years.
Right.
So those 3 साल का जो body में changes होते हैं, you are expecting, and today is the result. But whenever somebody goes to a doctor, he would expect, अरे मेरा period 2 ही महीने से irregular हो रहा है. It doesn't become irregularity or symptoms happen at the last stage.
Right.
So the treatment also takes time.
Right.
So the idea is that one should not be paranoid either ways. In our entire spectrum of practice, we see various kinds of patients.
Yeah.
But we also see patients who are paranoid or feel that tensed if their cycle moves by even 1 or 2 days. So let us say there is a 30-day cycle.
Right.
So we always tell the patient that 30 plus minus 5 is fine. So whether you get a 28 days or a 27 days or a 32-day cycle is fine. Don't be very choosy about 28 दिन तो 28 दिन पे आता है.
Yeah.
So either you should not be worried about something being very specific, or थोड़ा ऊपर नीचे हुआ तो भी you should be fine with it, but maintain a healthy lifestyle. So as a man, how would this period basically affect? Let us say the first month it becomes irregular, the second month becomes irregular. When do you seek opinion? Because normally the man would know in the first month itself that this cycle has skipped or it has prolonged.
If you're keeping track, though, most people
Yeah,
don't.
Normally couples do keep track, because if you skip a cycle, it could also mean a pregnancy.
Right.
So that is the other part of it. And unmarried definitely would keep check. Right.
Yes.
So, but as I said, that in the first month itself, let us say a cycle is skipped and you seek opinion.
Right.
At the most, the doctor might say, please lose some weight, or have a healthy diet.
Right.
You are avoiding all the further months of therapy, putting on additional weight, doing excessive investigations.
Yes.
So it's like going early for a class,
Right.
and not having to do a lot of homework
Later.
or a backlog later of completion of your books.
Prevention is always better than cure.
Sure, definitely.
Now, interesting when you talked about diet, and this is one thing that I learned the hard way, especially with my mother's health. And historically, if you see, at least our mother's generation, people who were born in the 40s, 50s, 60s, women were not necessarily eating very nutritious diets.
Yes.
And I saw it when suddenly it flares up as deficiencies. They show up as swelling of feet, for example, when vitamin D is lower, hemoglobin dropping, dizziness, neurological issues as they get older. Is it something, that very basic thing that we are missing is just what are our women eating?
Yes.
Are they eating fine or not? Because in some families, especially joint families that we have seen in the past, maybe even now, women eat later. All the men eat first. Then they're eating just what is remaining. They haven't cooked enough probably. Also, and they'll end up, if something bhaji is finished, then they'll just quickly make potato ka bhaji and wait. So mostly carbs.
Correct.
Do you see this happening still regularly?
See, as I said, I started with this idea of social construct. So this has been a normal pattern for hundreds of years.
Right.
That the women were made to eat later.
Yeah.
Now, what is to happen is, at that time also, men were enabling, but there were few of them, but they were bound by the constraints of society. So I do know even in our family of few men, if let us say the wife needed some protein, used to keep one extra piece of fish in his own plate.
Oh.
So that his wife could eat it.
Right.
Because उसका झूठा तो कोई और नहीं खाएगा.
Oh yes.
उसी plate में his wife would eat.
Correct.
So she could get it. But how often do we see it? So a lot of things have changed. Our daughters are now studying. They are learning. Look at it in a different way. I have a daughter. I make her sit on the table. Right? But my wife is still cooking. And she's serving on my table.
Right.
Why? Because I want to eat at 9 p.m. Can't I wait for her to finish everything?
Yeah.
We all sit down and eat together as a family.
Right.
And if something is needed, let us say I need water, or let us say my daughter needs water. Why does it have to be always my wife who gets up?
Yeah.
Can't I get up and get water?
Correct.
So the idea to move forward is to be inclusive. And what I would further go on to add is that when you eat as a family on a table, you know what the other person is eating. You can motivate other person to eat something which you have prepared. For example, let us say my daughter, she's also going to be a woman one day.
Yeah.
Let us say she is not having proteins. I see her having only rice and dal.
Yeah.
I can tell her that since we are Goans, we eat a lot of fish.
Yeah.
I can tell her that please try to have the fish.
Yeah.
It is good for your brain. It has omega 3. You can motivate.
Correct.
Now that happens because you know what your daughter is eating.
Yeah.
Why doesn't it apply to your wife? You understand? So when your wife eats with you, you know what she is eating, whether she is not feeling well, if she has not had enough to eat. Then you ask her, "Aaj kyun nahi kha rahi ho? Aren't you feeling well?" Then she would say, "No, I have got an upset tummy." Right?
Yeah.
Or I am just feeling nauseous.
Yes.
But I don't feel like eating.
Sure.
Then the next question is, do you want me to get something else for you?
Yes.
Would you like some ice cream? Do you want me to get something for you?
Correct.
So she feels heard. She feels understood. And you have an option. Somebody is there to give me a listening ear.
Yeah.
So that would be the right
So
way.
one thing that I read somewhere was that there is a huge percentage of women in India who are anemic,
Yes.
which is lack of iron,
Correct.
deficiency of iron, right?
Yes, deficiency of iron.
Do you see that still?
Yes, it is quite common, but the incidence is reducing now. But see, initially what was happening is iron was considered as a nutritional anemia.
Right.
So there were two categories of people, those who had and the have-nots.
Correct.
So it was more common in the have-nots, right? But it is surprising now that those who have, they too are developing anemia.
Yeah.
That is because of what they are having.
Right.
It is not that they don't have the resources to have,
What is it that?
but they have, they don't have healthy food.
Huh.
The amount of stuff that they eat out,
Right.
the fried, the oily stuff, unbalanced meals. So they would either eat only proteins or they would go for completely vegan diet. So our initial concept of the cultural sort of a balanced meal that we used to have in our thali system.
Yes.
Sabzi, rice, machi ka tukda, nahi to koshambir, the sprouted,
Yes.
everything little content in the amounts, including a little bit of pickle.
Yes.
Everything served at the purpose.
Correct.
But now what we do is we have one pot meals.
Yes.
Now when you have a one pot meal, you are having something less somewhere. So I think what happens is our definition of cooking or our definition of what is the need of the family over time is changing as per the social construct, because a lot of us are working. There are working families, the wife works, the man works. So all these factors matter. But as far as possible, if one tries to stick to certain good dietary habits, I mean, you don't land up with anemia unless your absorption itself is defective. I mean, your gut is not healthy, or these are issues which are not in your control.
Right. So is there some, do you tell your patients, or otherwise also, is there certain dietary additions that you should do around the menstrual cycles so that...
See, not specifically. Why should a menstrual cycle be considered something different?
Right.
Why do you need to only give diet special during the menstrual cycle? That is the first thought.
Right.
You can tell her to have a normal diet throughout, a regular good diet throughout. She may have a normal menstrual cycle, she may have an abnormal menstrual cycle. As a woman, she deserves a healthy good diet as usual.
Yeah. So all normal meals you should generally will be filled with
Yes,
everything.
yes.
And then beetroot, tomato, all these
Everything
things.
together, yes.
Right. Cool. Very good. So now let's switch to the next life cycle, so to speak. And most of young couples, for example, pregnancy. And that is a major thing for everyone. Like I always believe that your marriage changes your life, and then when you become a parent, that changes it completely.
Completely, definitely.
Right? First time, second time, whatever, but the first time for sure. Now that there is a lot of stress attached to it. What I observed was, the pressure on women to get pregnant is huge. And sometimes it's from their own family, not from the in-laws also. In-laws is also there कि भाई शादी हो गई, 1 साल हो गया, बच्चा कर लो.
Correct.
ये हर जगह से आता है. ये होता है एक तो, और दूसरा होता है कि उसके बाद ओके वंस यू डिसाइड कि चलो लेट्स हैव अ बेबी नाउ, देन दैट एड्स मोर प्रेशर कि इतने दिन से ट्राई कर रहे, हो नहीं रहा. डू यू सी दिस क्वाइट ऑफन?
Very common. Very common. What has happened is, as I said, now our social construct is changing. A lot of girls are getting education, good education.
Right.
And if I give very good education to my daughter, why shouldn't she have the same opportunities that any boy would have?
Yeah.
So marriages are getting delayed.
Right.
But unfortunately, God or whatever nature has not made us in a way, it has put up a biological clock in all of us. So pregnancies initially, they used to always say that you should complete your family before 30.
They got 2 kids.
Yes. Now there are certain countries, in the Mediterranean where women get married at 16, 17. They complete their family before 20. And there the other system such as the grandparents or the family system is very good. For example, Poland is one country which I know of. So they help to take care of the children. And then the woman can live her life after 20.
Yeah.
Right? But what happens now is a lot of marriages are getting delayed. Then everybody needs a very good environment to settle in. You require a nice house and in a good car and all your regular lifestyles or whatever sort of a things you need to be completed. And then comes pregnancy, because pregnancy is considered as a hindrance to progress.
Yes.
Because it's always the lady who has to compromise, because she has to take a maternity break, she has to feed the baby, she has to look after the baby.
That just adds to the pressure.
And what has happened is a lot of us are now going towards nuclear families.
Yeah.
So we have a family, a house which has only 2 or 3 people, and the parents are not staying with you. Many a times you used to have your uncle, auntie, everybody in the joint family. So बच्चा किधर भी खेलता था. So you used to have help.
Yeah.
But अभी वो help system नहीं है, support system नहीं है.
Right.
That is why this pressure comes. And if you cross 30, 32, then the pressure is tremendous.
Yes.
There is another angle to this. See, a woman is considered complete once she gives birth.
Only when she becomes a mother.
So that also is something which we have put inside us.
Yes.
Right? Why don't we consider about a man whose sperm count is nil? He may have a serious issue. He might have
What
had
is
an
a sperm count?
Sperm count is
Sperm
your semen.
count. Okay,
Sperm
okay,
count.
sperm count,
So he might have had an accident. He might have had an infection. He may not be able to have babies.
Correct.
But nobody questions him, the masculinity or him as a man. But they would always question the wife if she can't conceive. So many a times couples do come and they have not conceived for 2 years, 3 years, and the husband is not even ready to investigate himself.
Yeah.
He says, "Uska pehle test karao," and she's absolutely fine.
Yeah.
And बाद में after we are seeing this on a regular basis. In the first month, the husband is willing to get each and every investigation done for the wife.
But not
But when you tell him to do the sperm analysis, he'll say आज time नहीं मिला, कल मैं थका हुआ हूँ, I will get it done next week. ऐसे 2-3 months निकाल लेता है. 3 months के बाद समझता है कि his count is less.
Yeah.
And then he will say, I'm not eating this, I'm not eating that. See, the idea is you could have saved 3 months time. When we decide to treat, it's a couple which is treated.
Correct.
It is not the woman.
Yes.
So you have come to me as a couple. I always ask this question to the parents, that whenever you get a child, is she only going to become a mother? You are also going to become a father.
Yeah.
So बच्चा तो दोनों का रहेगा. So why not investigate both together?
Yeah. But tell me something, that's a situation which is, I totally understand, and doctors help there. But simply the act of conceiving, and it's literally a calendar thing.
Yes,
A lot of men don't know this.
correct.
What would you tell us how to really know when is the right time to conceive?
So I'll make it a very simple. Human reproduction for men, for humans, is one of the most complex among all the animal kingdom.
Really?
Yes, that's the first thing. The second part is that whether you try 10 times a day or you try three times a week,
10 times a day.
day or 3 times a week, the chances of conception in a month remains the same.
Ah,
That is 6%.
right.
6 to 7% or 6 to 8% is the chance that any woman would conceive in a month.
Why is that?
That is a natural conception rate.
How?
So that is, let us say 100 couples, they try to conceive in a month. 6 or 7 will get conceive within the first 1 month. Likewise, let us say every month you consider 6 to 8%, around 80% will conceive within the first 1 year. So many a time the patient is very tense or the woman is very tense. The moment she gets married, they come within 2 or 3 months. We are trying for 2 months and we are not conceiving. So even the act of intercourse they have under stress.
Yes.
The objective is bachcha hona hai.
Ah,
Objective is not to spend time with your partner. So what we tell them is that take some time, wait for a year and allow nature to do its bit.
yeah.
Now if they don't conceive within the first 1 year, then they should seek help.
And what does that help? So there is something that we had done, was like we went to the gynae and she helped us monitor my wife's...
The ovulation.
So can you tell us a little bit about that?
Yes. So what happens is, everything that can be calculated is if your cycle is regular. So if there is irregularity, everything goes for a toss.
Yes.
So the idea is first to get the cycles regular. The moment you have regular cycles, we assume that ovulation happens regularly. So unless you have a regular ovulation over a reasonably normal time, your cycle will not be regular.
In a month, how many days after the cycle is...
Yes, so I would say normally the ovulation would happen between the 14th day to the 17th, 18th day.
After the period is over.
From the day the period starts.
Starts, acha, okay.
So from the day the period is over is never considered as a date to calculate.
Acha.
Somebody may have 3 days, somebody may have a 5-day cycle, somebody may have a 7-day cycle. So we always calculate from the day the period starts, the flow starts. So the day your flow starts is considered the first day. And if you have a 28 to 32 day cycle, then you would expect ovulation to happen anytime between the 14th day to maybe the 18th day. So if anybody wants to conceive or try to conceive, then they should be having regular intercourse during these days. During these days.
Okay.
So, and that doesn't mean you can't have intercourse otherwise. But many a times couples mistake it and don't have intercourse throughout the month and try to have intercourse only during that time. So it becomes just an exercise rather than trying to understand the logic.
Yeah.
Secondly, what is regular intercourse is also not very specific. It is not that time wise it has to be done. It is regular intercourse means around 3 times a week. That is appropriate.
Okay.
So everything has to be comfortable.
Yeah.
There should not be stress.
I had read once, or somebody was telling me this, that after the intercourse, to increase the chance of conception, the woman should lie on her back and put her feet up. So let gravity do its thing. Is that true or is it a myth?
That only happens in movies. Otherwise, you would be having hangers in everybody's home to tie up the legs. But
Inversion is the big thing these days.
That is not.
It's like putting your feet up.
That is absurd. I mean, it's not possible.
So as men, what should men do to reduce the stress that a woman is going through? Because societally, and what happens is a lot of things, these things are not said to a woman in front of her husband.
Exactly.
It is happening on a phone call from her own mother, from in-laws, whatever. Somebody says, "Arey, aapko try karna chahiye. Good news kab de rahe ho?" That sort of thing is always hinted. So
and if I may interrupt, it is always another woman who says it again to the woman.
Possibly.
Most of the time, it is women who ask the women.
But I have also found that men tell it through women.
Exactly. Absolutely correct. Usko bolo. Exactly.
That kind of thing.
Exactly.
And that woman is also forced to say
yes,
whatever.
Yes.
But as a husband, what should a man do to reduce this a little bit?
So the first thing I say would, stand up for her. Make it a joint decision.
Right.
We don't want a child. We want to take some time off.
Yeah.
Why so much pressure put on her? The decision is mine.
Correct.
When we need to seek help, we will both seek help. As I said,
If ever you need to.
If ever we need to, and this is a private matter. It is something between a couple, right? So the thing is, if something happens when the man is not there, then I feel the man should talk to the people who try to do these things, because see, ultimately it is from the family itself.
Correct.
Most of the time it's the mother, or the mother-in-law, or the closely related people. So the thing is, the moment, as I said, the man stands up for the woman, she would feel enabled. She would feel more, proud and courageous to stand up for herself next time.
Yeah.
If the husband says that, I'm there for you when you need me, and this type of nonsense may not be is not going to be tolerated,
Right.
she can say it herself next time, no, because he will not question her, because he's right and she's right. So I think a lot of these actions start from us.
Yes.
Many a times what happens is, as a man would think, we don't want conflict. See, a man's mentality is such that we don't want conflict.
Correct.
So many a times when a difficult question is posed to us, which we know will not find an answer, we tend to avoid it.
Outside the ostrom well left.
ऐसे ऐसे करते हैं तो वो चुप के जा जाता है.
correct.
So it's like a tiger comes in front of you, you close your eyes, so you feel that a tiger has gone.
Not there.
But the tiger still remains.
Correct.
So you should not duck these things. You should be upfront. As I said, don't be judgmental, and stand up for the right thing. The moment a lady recognizes that you stand up for her and the right thing, not only stand up for her. Tomorrow she does something wrong, you can't stand up for anything like that. But as long as the act is good and it is correct, and you stand up for it.
You have to stand up for her choices.
Yes, exactly. And she feels empowered. It is not only related to fertility, it is related to number of children also. Yes. Let us say you have one child. Everybody says, और एक होना चाहिए, बच्चे के साथ खेलना चाहिए कोई. But she doesn't want it. You say fine. See, as a couple you discuss whether you want 1, 2, whatever. But once a decision is made, you don't say, oh, उसका decision है. दोनों का है ना, बच्चा तो दोनों को ही नहीं हो रहा है. No, both of you are not getting the baby, right? So why push it on her? I mean, ultimately it affects your family.
Correct. In our case, when my wife was pregnant, my belly was bigger than hers.
Oh.
So I used to say that, we get pregnant, like you're saying, it's a couple decision. So I said, we can put on weight. So, but, so now let's jump to the next stage, let's say, let's not talk about pregnancy as such, because there's a lot of material on it and each pregnancy is different. But postpartum, post the childbirth, a woman goes through a lot.
Yes.
Because physiologically things have changed completely. Right? Whether it's a C-section or not and all that. That's another difficult phase to deal with. Right? What have you seen? Let's just say normal cases. What would you tell men? Like, बच्चा हो गया उसके बाद, what is one is to take care of the child. Feeding and breastfeeding and all that is there, swaddling, diaper change. ये सब तो acts है जहाँ पे men are getting involved. I also, by the way, had the record of changing a diaper in 7 seconds. Susu diaper. Susu diaper. I asked all my friends whenever they had said, what's your record? So men also have this competitive string. So by the way, that helps. If you are a woman watching, make sure that your husband times his diaper change, so that make him do more. But postpartum depression especially is not understood enough.
Yes, that's a major thing, because we have seen a lot of patients having postpartum depression. And see, there are so many reasons. The body changes. They have, many times a woman has hair loss, and hair is a very, very important part of a woman's body, and they are very sensitive about it.
Sure.
So because of these hormonal fluctuations, they get hair loss, they get irritable. She feels that people don't understand her.
Yes.
You understand? Now, as I said, right from the beginning, it has been considered that the main job, or to look after the baby, is the mother. So whether the baby remains awake throughout the night, she has to be awake. So it is considered her primary duty. So and the man sleeps. So we have to equally judge it. And it helps the man as well. It helps the man get closer to the child. He develops a sense of maternal feeling.
Yeah.
You are understanding. You are a father, but you get what is the sense of a maternal feeling, that heartache or that pain. I am a father too, so I am telling you this out of experience.
Yes.
The more you do for your child, it makes a bond between you and your child.
Right.
Also improves the bond between you and your wife, because she understands that you are doing it so that she can take rest.
So there is somebody there.
There, absolutely.
I should not be so worried anymore.
Correct. And the one of the biggest factors for postpartum depression is lack of support.
Achha.
So we always say, what is the treatment? We say TLC, tender loving care.
Ah,
These three words, tender loving care, can treat 50% of ailments. Because majority of the times, the ladies feel that I am all alone now. बच्चा है, आई कांट गो टू ऑफिस, देखो मेरी हालत क्या हो गई है, ये सोने नहीं दे रहा है, वो भी सो नहीं रहा है, मैं भी नहीं सो नहीं रही हूँ. If I call, he's to office, if something happens to the baby, if the baby doesn't do susu, she or vomits, everything I will be responsible for. So she keeps on going downhill.
yeah.
And then lack of family support, saying that don't worry, I will manage, you sleep. आपको क्या खाना है, नहीं तो इस वीकेंड को आप बाहर जाके आओ, I will come with the baby behind, you don't have to hold the baby. So she wants to
Small
get back,
things.
small things.
Yes.
So she wants to get back to her life.
Right.
And then sometimes they feel that the baby is what keeps them from getting back to her life.
Oh, that's the cause in
Yes,
their heads.
in the head, because they get tied down. नहीं,
Right.
husband goes out with friends over the weekend, तुम नहीं आ सकती हो क्योंकि बच्चा है, आप बच्चे के साथ घर रहना, मैं जाके आता हूँ, फंक्शन है, इसको सब लेके किधर जाएंगे, दूध ये वो सब, उल्टी किया तो फंक्शन को गए तो इफ ही passes stools, then आप अंदर जाके उसको चेंज करके लेके आओ, मैं इधर बैठता हूँ फ्रेंड्स के साथ. So look at the dynamics. So always it is an expectation level which is put on her. Much more expectations are put, and then she has to live up to those expectations. So she feels, "Arey, what is my fault? Just that I became a mother."
So simultaneously, one of the best things to have happened in life
Yes.
has immediately turned into the worst
something
thing.
exactly opposite. So if there is a very good support system, then you make her realize that having a baby doesn't stop you from being a woman.
Right.
Right? So being a mother doesn't mean you can't continue to be a woman
Yeah.
as early as possible.
Yeah.
So going out, taking her out, going, you go for a vacation, go together, take her out. So, that nothing different has happened. I'm back to my life.
Correct.
So these are positive. So when does a person go in depression? When he feels that there is nothing positive to look forward to.
Right.
So rather you give certain incentives that life is beautiful.
Yeah.
And will continue to be beautiful. You have to only try to go towards it.
Correct.
You understand what I'm saying?
Yes.
That is why, as a part of depression, a lot of this therapy is focused on exercise, doing something that you like, creativity.
Yeah.
So you tend to, get up your mood and try to walk forwards.
Yeah.
That life is worth living. So that you need to get her back on track.
Correct.
So that is the better way to do about it.
So simple thing, like I remember we used to watch a lot of movies. Every Friday जो भी movie release हुआ हम जाके देख रहे हैं before the baby. Now after the baby, finish.
सब बंद
हो गया, movie जा ही नहीं सकते.
Correct.
So that's a big factor. So how do you have movie nights, for example? तो चलो क्या फर्क पड़ता है. So we went, and अगर बेबी रोता है तो मेरी रिस्पॉन्सिबिलिटी, मैं जाके बाहर ले जाऊंगा, तुम मूवी देख लो, कोई टेंशन नहीं है, figure it out, we'll figure this. Simple things like that can, I would.
Yeah, see, basically compromises have to be both ways.
Correct.
The idea is, I will not change anything, but you change everything.
Yeah.
It's a wrong concept.
That's right.
The idea is, let us together try to make things possible. Sometimes you, sometimes me.
Yeah.
Child belongs to both of us.
Yes. Very important, very important. And then if we move forward and towards as we become older, our age, 40s, and your wife is, you've been living together, and you are hopefully friends.
Correct.
And still, I think a lot of times women don't even disclose what they're going through to their own husbands of years.
Yes.
Does it happen to you that patients come and they are telling you more and the husband has no idea कि ये सब हो रहा था?
Absolutely. This thing happens very, often. So many a times the husband has been told, but he's ignored it and is not aware.
Yeah, कुछ नहीं है.
So she comes. Basically, she wants to open up and express herself. So कोई बोलता है यार ये कुछ नहीं है, कुछ नहीं होगा, रोज तो बात करती हो. But they don't realize that it could be something as simple as a yeast infection. Many a time the most common complaint is the white discharge or some discharge issues, which is negated as something which is as trivial.
And you as a husband don't even want to see it.
Exactly, you don't want to give it a thought also.
Correct.
So rather, you go to a gynecologist and he would try to ascertain whether it is normal or abnormal. It's a job, we can't say everything is normal.
Yeah.
But we can always, because see, every woman is different.
Yeah.
There are some women which have a normal discharge which is excessive. And they compare it to a woman who is having a normal discharge which is regular.
Yeah.
आप समझ रहे हो? So let us say I am used to having 1 glass of water a day, and for somebody he may be having 2 glasses of water a day.
Yeah.
Both are normal.
Correct.
So you can't compare two women.
Yeah.
But the idea is to impress upon them that this is normal for you.
Yeah.
And assuring them that there's nothing abnormal done. And the third way is you try to tell them how to identify
Yeah.
if things become abnormal,
Yeah.
and then to follow up.
Correct.
Now this discussion cannot happen with the husband.
Yes.
But the husband, at least, once he understands that she is having these repeated issues, should get her for a consultation.
Yeah.
So the idea is, as I said, a man has to be, understanding and also enabling.
Yes.
You can't just say I understand, पता है आपको बहुत तकलीफ हो रही है, सब समझ रहा है, सब समझ रहा हूँ, लेकिन मुझे अपॉइंटमेंट नहीं ले रहा हूँ, आज टाइम नहीं है, कल टाइम नहीं है, इसके साथ जाओ, उसके साथ जाओ. Secondly, there are so many personal issues
Yeah.
that maybe she may not open up if she goes with somebody. आप ड्राइवर के साथ जाओ, नहीं तो भाई के साथ जाओ. You understand?
Yeah.
And sometimes she may want the husband to be there in the consulting room when she talks to you.
Great.
Because it may be related to personal issues
Yeah.
like intercourse and things like
Right.
that.
Right.
So these things she may want the husband to be there. So even if she goes alone, it doesn't solve her problem. What she is asking you is only for support.
Yes.
Whatever you have assured her when you are taking those sat fere
Yeah.
or whatever it is, vows of marriage, that you are always going to be with her and things like that. She's telling you to only fulfill that. She's not asking you anything more than that.
Correct. Very true. And I think one thing I've learned the hard way is also not to joke about things, because that's also a lot of men do. We do end up doing that. Even when we are in front of the doctor, I used to crack silly jokes. I don't know why. I just would. Somehow it was funny. You grow up making fun of some things like, "Arey, iska wo time chal raha hai."
Correct.
She's acting up, PMSing ho raha hai. Even in offices,
Yes,
people do
yes,
that.
yes.
I don't know, sometimes women participate in those jokes or not, but it just seems very insensitive for us to crack such jokes. That is one important learning that most men should have. You should not crack some of these jokes. Second thing is that we have, internalized this aspect that sometimes women have to take care of it themselves. We can do nothing about
Nothing
it.
about it.
है ना. अब जैसे फॉर एग्जांपल एक बार ऐसे हमारा डिस्कशन हो रहा था कि व्हेन देयर इज विंबलडन गोइंग और सम मेजर स्पोर्ट्स थिंग, विंबलडन बोलो, ओलंपिक्स या क्रिकेट वर्ल्ड कप वगैरह जैसे हो रहा है, एंड विमेन आर प्लेइंग एवरी डे, फॉर एग्जांपल दे आर एक्टिव. सो हाउ आर दे मैनेजिंग देयर पीरियड्स एंड ऑल दैट एट दैट टाइम? हाउ आर दे इन पीक फिजिकल कंपटीशन एंड परफॉर्मिंग एट दैट लेवल, एंड देन यू से अरे उसको देखो और तुम क्या रो रही हो? ये भी एक डिस्कशन होता है घरों घरों में.
करेक्ट.
कहते हैं इतना क्या है,
करेक्ट.
तुम फालतू में विक्टिम पना मत करो. ये भी होता है. हाउ डू वी, this is tricky.
Yes.
I don't know what is right or wrong,
See,
but I'm
so-
sure we are more on the wrong, I think.
So I think the way out from this is, first never trivialize a complaint.
हाँ.
It's not up to you to either judge whether it is significant or not. Like, let us say a patient comes to you with a small complaint saying that there is a slight spotting. That spotting could be anything from cancer to something as trivial as nothing. So that never trivialize a complaint. That's the first thing. Never make a person look low. And then that person will stop sharing things with you. The moment he realizes that he or she realizes that you are making fun of it, or you don't give importance to that. So the point is, there is no point in discussing it with you.
Yeah.
That is how they start getting quiet. And then they will share it with their friends, and then somehow one day they will end up with a doctor. By the time it is late. So we cannot compare. As I said, that there are women in army, there are women in sports, and they have reached such heights that even we can't imagine.
Yeah.
But the way a man looks at it is different, and how a woman feels it is different. Not looks at it, because you are commenting upon a condition what a woman feels. You are looking at it. You understand?
Yeah.
So rather, I would say we as men should change the way we should think.
Yeah.
We should try to feel what she would feel. Let us say a man is at home lying down and he has a chest pain. The woman cannot say it is just gastritis, nothing is there. Can a woman say that? She will fear. She will say, what is ko heart attack aa raha hai? If it is MI or something like that, ischemia, she will think of the worst consequences, right? So what will happen tomorrow if a man gets neglected like that and then dies?
Oh my God.
That could be the worst thing. So the way a woman should not trivialize a man's complaint, a man too should not trivialize a woman's complaint.
Yeah.
So it has to be equal partnership. So these see, in any relationship, there are jokes, there are, things that you have fun with and things like that. But as I said, there should be areas which one should not cross.
Yeah.
And those areas or lines are drawn between every couple
Yeah.
based on the two individuals.
No.
What line I put as a red line may be a grey line for you.
Yeah.
So each couple should work and they basically find their own grey lines, red lines, green lines, and then decide to stick to them.
Yeah.
But as a man, accept what a lady says
Right.
and don't trivialize it
Right.
as a first. The second, try to be supportive, understanding, and ask whether that you need to take her for a visit. And if she says, yes, I do feel this needs attention, then as per her request, take her for an attention.
Very nice.
Simple.
So I learned some of these things. Now, obviously, don't trivialize, be supportive, don't be judgmental.
Yes,
And I think it's doing the small things.
exactly.
And I think whatever you have said doesn't sound like a lot of work to me.
It's not a huge thing, it's a small things to take care,
Yeah. Just take her out, take care of the baby once in a
Yes.
while. I mean, some of these little things, if we do right, it's fine. And just have a talk. I mean, wife is one thing, mother is another, daughter, sister. If you're available to them emotionally, then they will open up. And then eventually, they will tell you more.
Yes.
And that,
Why don't we all do a small, sort of a exercise? Every day the woman cooks for us. And we sit on the table and we say, अरे आज ये बराबर नहीं है, इसमें नमक कम है, इसमें मिर्ची थोड़ी ज़्यादा है, इसमें ये थोड़ा कम है, वो थोड़ा कम है. One day, why not we cook for our wives? One day you decide which one day मैं खाना बनाऊंगा, you give me the recipe, I will do it.
yeah.
And then we put that on the table and let them eat the food. And then you also eat it and you see what difference is there.
Correct.
That day you will stop complaining.
Yes, when somebody is judgmental to you, that's when you'll realize.
Exactly.
But I think there would obviously be people who will say कि अरे ये तो women का है, men भी तो जाते हैं
Exactly.
do different things.
Yes.
What about that?
Yes.
I think the same applies the
It
other
is
way
the same
also.
rule. Basically, you consider them as equals.
Yes.
And consider them equals not only for the sake of saying that they are equals, but inclusively, give them those responsibilities.
Yeah. Correct. Now let's just look at some of the aspects of your work, and something that as a society that we have. One question that a lot of people always have is that are women comfortable going to a male gynecologist? Is that something you have faced?
See, per se, I have not faced this issue at all. I'll give you a simple example. What used to happen is, let us consider 50-60 years back. Number of daughters who were educated itself were less.
Yeah.
So, in a medical college, let us say there were 50 seats. There used to be 40 men or 45 men and 5 women.
Right.
So, there was very less incidence of female gynecologists right from the beginning.
And also after graduation, how many are actually working?
Joined gynecology because they were used to get married, have families, all these things used to apply. As time went on, the number of girls getting educated have increased. So when I joined medicine, we were a batch of 70. I think we were equal. So equal number of boys, equal number of girls. Then there was a merit system. So whoever gets a merit spot gets the field that he chooses to join.
Yeah.
Now with a lot of girls getting educated, there are more girls entering medicine than boys. So maybe another 10-20 years down the line, there will be lesser male gynecologists and more female gynecologists. So rather than that, I think one has to focus on rather who is a good doctor and a bad doctor.
Yeah.
So why be gender specific?
Correct.
You can have a bad gynecologist who is a lady also and a man also, and a good gynecologist who is a lady and a man also. But in Goa or the area where I practice, like my father has also been a male gynecologist, I am also there. There are so many colleagues of mine who are male gynecologists. The people or the patients or the women here don't do a distinction.
Yeah.
Some patients do still ask that they would want to get examined from a female gynecologist, wherein my wife was also a gynecologist, so at that time she used to examine.
Yeah.
But as a couple, we used to see them together, because what happens if there is a problem? Let us say there is a complication, then you would say, अरे कैसे भी बचाओ, कोई भी आगे बचाओ तो बचाए, वो टाइम पे तो नहीं देखेंगे कि मेल है या फीमेल है.
Correct.
Right, you want to live, right?
Yes.
So if there is heavy bleeding and let us say that time if there is a distinction कि female ही आके manage करेगी, male नहीं जाएगा, if she needs a male hand, what happens?
Correct.
So I would rather keep it as very simple. There are good doctors and bad doctors.
Right.
You know a good doctor, whoever he is, be comfortable,
Yeah.
open up,
Yeah.
be safe, and once you have trust, go ahead. It doesn't matter who is there.
Yes, correct. Good. I think there is a lot here that we covered today. And as doctors, there is such a great work that you guys do, and so many things that you do which most otherwise untrained people are like, कैसे handle करते हो भाई? You know? And there is another thing that people say is doctors की life नहीं होती. And you are living here and your hospital is downstairs. Is it true कि doctors की life नहीं होती?
See, it becomes
कभी भी
difficult.
call आ जाएगा, जाना पड़ जाएगा.
So that is as a gynecologist is there are few branches which have lot of emergencies. One is gynecology.
Right.
So for a gynecologist, what happens is that you can be called anytime. See, pregnancy is a very sensitive area.
Yeah.
And the thing is, bearing a child, a smallest issue, any patient wants immediate attention.
Yes.
Immediate attention, the doctor has to attend immediately. So for that reason, many a times what happens is we cannot take the vacation as planned vacation.
Yeah.
We have to inform our patients in advance. And many a times the patients are also not upfront.
Yes.
See, whenever we book a patient or register a patient for childbirth, we presume that a particular patient will deliver in this particular month.
Yes.
So that month, how would the patient feel if I just take a vacation and leave her halfway? So what I do is I block those dates, saying that these are the dates I cannot move out. But imagine what the patient can do after 8-9 months. She doesn't tell me, she doesn't come up. She goes to another gynecologist or she goes to a government hospital for a delivery. So I have lost the time where I could have taken my own child for a vacation.
Yeah.
So that trust factor, truthfulness over the time is not the way it used to be before. But as I said, I love the field and it is one of the good fields where you feel a lot of happiness when you give a child in a mother's hand.
Yeah.
So, whenever you deliver a child and that feeling is, it's exceptional. That the way everybody is happy and that stars in their eyes, whether it's a girl, whether it's a boy, and they are enjoying, you are understanding.
Yeah.
That feeling only a gynecologist can
Correct.
give. And it comes at a price, and as I said, any field has a price. You decide to pay that price, the happiness also is like that.
Correct.
So, but the advantage is since I live above the hospital, attending an emergency is comparatively easy for me. So, our hospital is 3 floors, I live on the 3rd floor and the entire hospital is 2 floors below.
Yeah.
So, for me the hospital is my home and my home is my hospital.
Yeah.
So, कभी 2 बजे भी patient आता है तो I am available.
Correct.
So, patient feels safe. Doctor घर ही उधर ही है. So, there are many times when a lot of patients of other doctors also come because sometimes their doctors don't live close by.
Yeah.
It is not that the doctors have abandoned
And
them.
especially with gynaes because it's a long process. You start
Correct.
from 3 months on.
Exactly.
So it's a 7-8 month long relationship,
Yes.
at least for childbirth.
Correct. So as a team, like the area where I practice, we all function as a team. So एक बंदा नहीं रहता है तो you cover up for him. So patients do know that they would get care. I mean they will not be left to fend for themselves. So that feeling of safety is there.
Right. Very interesting. And I think we've covered almost all the things that we were thinking of, especially on the psychological side. I think we'd just like to add that everyone is different. None of what we have discussed today is necessarily medical advice, although he is a qualified doctor. But it's always better that you go and seek your own medical advice with a doctor who knows you physically.
Yes.
So it's better that you do that. But what we did today was to talk about things that otherwise not get talked about.
Yes.
And I think I would encourage everyone watching and listening to sort of do that discussion.
Exactly. Talk to your wife, talk to your woman, talk to the lady in your house.
Yes.
Talk to your mother for that matter.
Yeah. Very interesting stuff. So, Dr. Mithun, tell me one thing. A lot of times what happens is patients themselves are confused. They've gone to multiple doctors, they've taken multiple opinions, and these days AI is there, people are Googling and they see whatever. When that happens, how do you deal with that sort of a situation?
So, the first thing, normally that many patients nowadays, they are educated patients.
Yes.
But that is half knowledge. So, they would do Google, they will, go to AI and they do not understand the ramifications. So, whenever you get information, you should have the ability to process that information. And the information that is processed comes with experience and knowledge. So, today if I decide to, for example, try to learn to, clean or repair an electrical circuit just by knowing what it is, I could die also with a shock.
Yeah.
So, only an electrician can assess or process that information properly.
Correct.
So, in the same way, many a time patients come with conflicting opinions multiple times. So for this, I remember, a small story which was told by Gautam Buddha. That what happens is, so what happens is that once there was a monk who was going with his disciple, and they were trying to cross a river. And there was a beautiful woman on the river bank. So she requested the monk that kindly help me cross the river. So the disciple said, I am not going to do that. I am a monk. I cannot touch women. So the teacher, then she asked the same thing to his teacher. The teacher lifted her up and he crossed the lake or crossed the river and kept her on the other side and told her to go.
Yeah.
The disciple said, Are, you have taken monkship. I mean, you have become a monk. You are not supposed to do this to a woman. This, that, is that. So the teacher said that, see, I have anyway forgotten about the woman. You are still thinking about her. Right. So he showed him the same river. It was cloudy. There was all mud mixed with water because they had walked through the river. And he said, what do you see now? He says, all the mud. Can you see the floor of the river or the base of the river? Okay. He says, no, I can't see what is down. So he says, wait for some time. So he allowed the river to rest. With time, the mud settled down and there was clear water and he could see the floor of the river. So he said, with time, when your mind is relaxed, you can see sense. So whenever you are faced with conflicting opinions, go to a person who can remove that mud out and try to give that clarity to you.
Yeah.
Once you seek that clarity, don't go to anybody else. To again make the whom you trust, whom you inside from your heart, it gives you that feeling that nahi, ye banda sahi hai. Listen to that one opinion, trust in him fully and go ahead. Wow. See, the idea is to sit down, relax and think what is acceptable to you.
Wow.
Because everybody wants the best outcomes.
Right.
Nobody wants a bad outcome. But it's two sides to the same coin.
Yeah.
You have to have the both sides of it. You may have a good outcome as well as a bad outcome.
Correct.
It's a part and parcel of life. So the idea is let it settle, relax, go to the right person who can make sense the way you would expect it to.
Yeah.
Leave out the unimportant things and focus on what matters. And once you decide that, don't change that decision, go ahead with it.
And if somebody is in Goa, how do they reach you?
So I am in North Goa. I practice at Mahatme Nursing Home.
Bicholim.
It's there on Google, Bicholim. It's accessible. So they can get the details from the website and they can just call and come. I am free. I am free to help for anything.
Nice.
Forget about gynecology, but as a person, I am free to help anybody who needs my help. That's
Brilliant. I think that's a lovely thought and lovely lesson.
Thank you.
Great. Thank you so much, Dr. Mithun, for your time today. I know there are lots of work that you do every day and so many patients. I have seen it myself. So, and lovely hospital, I think very good care that is now available in this area, which is not the typical Goa that people see from outside Goa.
Exactly, not the beach side.
Not the beach side. Lovely place, by the way. Should definitely, everyone who is watching should visit Bicholim. We went to your Vatadev Mandir
Residence,
also today,
yeah.
which is lovely. I think these are, I think maybe don't go. Let it be unexplored. It'll be nice. पता नहीं 1000 टूरिस्ट आ जाएंगे फोटो खींचने के लिए. But अगर कुछ परेशानी हो तो of course Dr. Mahatme यहीं पे है.
Yes, thank you so much.
Thank you so much, Dr. Mithun. Thanks again.
Bye.
And thank you so much for watching. Stay tuned for more.
ज़्यादातर यहाँ पे गायनेक के पेशेंट आते हैं, पीरियड प्रॉब्लम, इनफर्टिलिटी वैसे.
इथे लॅप्रोस्कोपी होतात, इनफर्टिलिटी केसेस असतात, प्लस मेजर मायमेक्टोमी, हिस्टेक्टोमी हे सगळे केसेस होतात.
थोड़े थोड़े लोग आते हैं, थोड़े नहीं आते हैं. ज़्यादातर लोग ऐसे वैसे सपोर्ट नहीं करते हैं.
त्यांना कम्पेअर करायला त्यांचे रिलेटिव्स असतात, थोड्यांचे मोस्ट ऑफ द टाइम्स हजबंड येतात. थोडी बायका समज हजबंड त्यांना तेवढं हे करत नाही तर ती एकटे वगैरे येतात ना, रिलेटिव्ह बरोबर येतात.
ज़्यादातर आते हैं, थोड़े पेशेंट के साथ जो नहीं आते हैं उसके साथ उनके फैमिली आते हैं. थोड़े होते हैं जो समझते हैं, लेकिन ज़्यादातर उन लोगों को नहीं पता होता है प्रॉब्लम क्या है वैसे. और ज़्यादातर लोग वुमन को ही मिसअंडरस्टूड करते हैं. ऐसे प्रेगनेंसी के लिए कंसीव नहीं होना, इसीलिए वो वुमन को ब्लेम करना, वैसे वाले.
अच्छा.
आहे बरं आहे.
आहे?
नाही नाही काही प्रॉब्लेम नाही, सांगतच नाही मी काय झालं तर.
का बरं?
त्याचं काय, तो आपलं हे करतो ना, मी काही कसं सांगणार.
काय त्याला कळत नाही म्हणताय की तुम्ही बोलतच नाही?
बोलतच नाही. त्याचं असं सगळं ना, आपलं हे होत आहे ते होत आहे,
मग तुम्ही कोणाला सांगता?
असं कोणाला घरात सांगते,
मुलीला?
डॉक्टरला इकडे.
उनको पहले तो अपने पत्नी के साथ बात करनी चाहिए, पूछना चाहिए क्या प्रॉब्लम है, क्या नहीं है. फिर उनके साथ डॉक्टर के पास जाना चाहिए. डॉक्टर से पूछना चाहिए कि क्या होता है, कैसे होता है, और ये सब तो होता है. बहुत लोगों के साथ होता है, फैमिली सपोर्ट नहीं करते हैं, फिर हस्बैंड भी फैमिली के साइड हो जाता है, फिर उनकी पत्नी अकेली पड़ जाती है. ऐसा होता है केसेस में.
हां, म्हणजे असं बायकोला समजून घेणे वगैरे.
थोडी पेशंटचे हजबंड्स खूप केअरिंग असतात. असं बघायला गेलं तर रोज त्यांच्या बरोबर येतात. थोड्यांना केअर एवढं वाटत नाही की म्हणजे डेली ते एकच म्हणजे तिला एकटीच पाठवतात. पण अदरवाईज तसे हजबंड्स केअर करतात. मोस्ट ऑफ द टाइम्स आम्ही बघितलेलं थोडे असे नाही आहेत की एकदम आणखी म्हणजे केअरच करत असं कधी नाही आहे. ते केअर युजली दे केअर समजायला हवे. तसं बघायला गेलं दे हॅव टू अंडरस्टँड. बिकॉज आता असं जनरेशन आहे की बोथ आयदर फर्स्ट असायचं होतं की अरेंज मॅरेज जास्तीची असायची, सो दे यूज नॉट अंडरस्टँड इच अदर. थोडी एजमध्ये मोठे असायचे, थोडी गर्ल्स कमी म्हणजे एजमध्ये यंग असायचे. बट नाव डेज लव्ह मॅरेज वगैरे असते, सो दे हॅव टू अंडरस्टँड इच अदर. म्हणजे जनरेशन्स किती तेवढे पण पास्टमध्ये नाही, म्हणजे दे हॅव टू बी लाईक वन. आता एवढे डिफरन्स नसतात एजमध्ये, बट पहिली एजमध्ये खूप डिफरन्स असायचा अँड दे यूज टू नेव्हर अंडरस्टँड इच अदर. बट नाव अंडरस्टँडिंग बघायला गेलं तर हजबंड अँड वाईफ मोस्ट अंडरस्टँडिंग आहेत. अँड ते म्हणजे कम्पेअर केलं तर कसं होतात, इवन मेन्स प्रॉब्लेम्स आर अंडरस्टूड बाय वुमेन अँड वुमन ऑल्सो अंडरस्टँड द वॉट एव्हर इज हॅपनिंग इन देअर लाईफ. सो आय थिंक बोथ आर अंडरस्टँडिंग फॉर नाव ॲज इन दिस जनरेशन बघायला गेली तर. पास्टमध्ये पण आहेत, बट तेव्हा कसं एवढं रिव्हील करत नाही की आपल्याला काय प्रॉब्लेम्स आहेत, काय होतं ॲक्च्युली त्यांनाच कळत नाही फॉर वुमन. बट नाव they are so close to each other, they talk to each other and they tell their problems. So तसं आहे.
I don't think they need to understand gynec at all to understand women. Why they have to be a gynecologist? If the woman is sick and she has some health issues, then it's a different issue. Well, she won't go through anything if you are respecting her, if you are behaving with her and giving her the necessary respect which she needs. So you be good, everything will be good. No, they don't need to. They have to be just good. So if they are good, they will be good to everybody, whether they're women, children, sisters, anyone. If the man behave with them in that particular way, anybody, any two individuals, why it is so gender specific you are making it?